So the Project Fit Rounds is really about the goal of really being able to bring our clinical care teams together with our patient, actually explicitly at the patient bedside, and with the goal of really increasing communication, improving engagement, to ultimately be able to reduce our length of stay and be able to reduce readmissions.
It's a rare opportunity for the patient to be able to peek behind the blinds and see the collaborative care team at work. But even more importantly, it's a chance to engage the patient in their care. We're not doing care to you. We're not here in front of you telling you what's going to happen. We're here working with you as a team. We're bringing you into the circle, in fact, at the center of the circle, and making you an active participant in your care plan.
And so when we look at this from the perspective of the voice of the patient, this is really about physically centering the patient within our Fit Rounds, bringing our care teams to the bedside, and so that not only are we having these discussions about the patient, but we are actually having these discussions with the patient. And that way their voice is heard, their questions are answered on a daily basis.
In redesigning our Fit Rounds, we knew we wanted to do three things. We wanted to optimize the patient experience and bring them back into the conversation. So we wanted to focus on changes that did that. We also wanted to improve interdisciplinary communication, which again had become more siloed in the setting of COVID, and kind of bring us all to the table. Lastly, we wanted to focus on changes that helped us improve patient flow and patient outcomes data. Things like length of stay, perhaps readmission, unplanned readmission rates, and estimated date of discharge.
We actually had one of our patients participate, and it was extremely insightful to hear of our patient and her own experience of what she went through in the hospital, the questions she had, the uncertainty that she experienced at times. Where she saw the success or impact of Fit Rounds was really being able to answer those questions that she had, address the uncertainty, to really ensure that everybody was on the same page. Though really thanks to this Kaizen event, we were able to really, and when I say Kaizen event, we're talking about good change and really following that spirit of continuous improvement. And in doing so, this is really what allowed us to accelerate that change and be able to bring this forth at UCSD.
From the beginning of my work on Fit Rounds, my favorite part has been working with interdisciplinary leaders from other disciplines with different expertise, different perspectives. You know, we all have this shared passion to improve patient care.
Fit Rounds really only works if the entire team is participating and engaged in this. And so a shout out to those departments, or really want to give recognition to those departments who helped in this design